morning, Trinidad and Tobago and the wider world, and welcome to another Ministry of Health update on the national COVID-19 response. Our presenters this morning are Dr. Roshan Parasram, Chief Medical Officer, Ministry of Health, Dr. Erica Wheeler, PAHO WHO Country Representative, Dr. Rian Extavor, Program Manager for the Caribbean Regulatory System, CARFA, and I also want to welcome Dr. Maria Luz Pombo, who has joined us virtually on our virtual platform. Dr. Pombo is an advisor on vaccines and biotechnological products for PAHO WHO Washington, and she will treat with the technical aspects of any questions surrounding the extended shelf life of the Pfizer COVID-19 vaccines. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health and moderator for this morning's update. I now invite Dr. Parasram to present the latest clinical and vaccination updates. And, of course, October marks the beginning of the 2021-2022 influenza season. Dr. Parasram will share some very important information that you will need to hear. CMO.
Hi, good morning, Al. Good morning to Dr. Wheeler, Dr. Extravor, from the Pan American Health Organization and the Caribbean Public Health Agency, members of the media, members of the viewing and listening public. So as we begin in our usual fashion, we can start with the COVID-19 update for October 19th, given our total persons tested to date at 375,969. Our new positives over the last 24 hours stand at 138, taking our total positive cases since March 12th to present to 54,405. Those who have recovered so far, 48,526. And in terms of our active cases, we have 4,266. Our total patients in hospital now stand at 289, and those in step-down facilities at 50. Our deaths so far since the beginning of our pandemic, 1,613 deaths, and condolences to the families of all of those persons who would have lost loved ones during this time. In terms of our vaccination statistics, up to 4 p.m. yesterday, our first dose of a 2-dose regime, 612,861. Total persons vaccinated with a second dose of a 2-dose regime, 539,901. Those with a single-dose regime, 31,130. And those who have completed vaccination, both adding 2 doses of a 2-dose regime plus the Johnson & Johnson, 571,031 persons. In terms of our percentages of patients in the parallel healthcare system who are not fully vaccinated during the period July 22nd to September 29th, we have 94.5%, which is 3,866 of 4,090. So as Mr. Alexander would have said, we begin the flu season in the Northern Hemisphere during the months of October to May of the following year. And as such, Trinidad and Tobago has received its first shipment of influenza vaccines for the season via the Pan American Health Organization. And we just wanted to give some brief information to update the population as to the signs and symptoms, the transmission, prevention, the target groups we're looking at for vaccination, where to get the vaccine, and of course, some final updates related to the vaccine supply and some intricacies about when to have it in relation to the COVID vaccine. Next slide, please. So if we go into the other slide, so it is again, influenza is a contagious respiratory illness caused by the influenza viruses that infect the nose, throat, and sometimes the lungs. It can cause mild to severe illness and at times can lead to death. And we have seen deaths in this country from influenza in the past. Prior to COVID in 2019, we would have had quite a increase in number of deaths in that particular year, where we had 40 cases coming to the end of the flu season, the beginning of the flu season in 2019, followed by a subsequent decline. Next slide. The flu season generally starts, as I said, around October to May in the Northern Hemisphere. It's the reverse as it related to seasonality in the Southern Hemisphere. Next slide. So signs and symptoms are very much like COVID. They're very similar to the common cold as well. So you get fever or feeling feverish, chills, cough, sore throat, runny nose or stuffy nose, muscle or body aches, headaches, fatigue, in rare cases vomiting and diarrhea, which tends to be more common in children. Next slide. So it is transmitted very much like COVID-19 by respiratory droplet infection. Particles are inhaled when persons sneeze or when they come in contact with a contaminated surface. So touching fomites, which like doorknobs, desks, etc. And the measures we have put in place for COVID-19 are doing well to control both COVID-19 as well as the spread of the influenza virus. Next slide. So take the new 2021-22 flu vaccine following the Ministry of Health's public health guidelines will also help with decreasing the rate of influenza circulation within the country. Wearing your mask, covering your mouth and nose when you sneeze or use a tissue, wash your hands with soap and water, avoid close contact with people who have flu-like symptoms, maintain social distances. If you have symptoms, of course, you seek immediate medical attention. If you experience difficulty in breathing, chest tightness, inability to eat or drink, and persistent vomiting or confusion, those are warning signs that you need to get to a facility or seek medical care urgently. Next slide. So going forward, beyond that slide, please. Yeah, so why vaccinate every year? The new vaccines are released every year to keep up with the rapidly adapting and rapidly changing. We have come to learn about mutations in viruses. This is common for the flu viruses. They mutate, and generally speaking, the vaccine that we have this year is adapted based on the mutations that would have been found from last year's circulating viruses. So when you get vaccinated, if you could go back one, please. So when you get vaccinated, your immune system produces antibodies to protect you from the viruses, including the vaccine, and antibody levels generally, as it relates to the flu vaccine, declines over time. So you get a new vaccine taken every year to ensure that your antibody levels keep pace with the changing viruses that are circulating. Next slide. So this year, we received through PAHO, protecting against 4 strains of the influenza. So the influenza virus, generally speaking, has 4 different subtypes, A, B, C, and D. A and B are of concern to humans. D is really an animal disease to the most part. And type C is generally very, very mild and therefore doesn't cause significant severe issues in the human population. So we focus on A and B. A, again, these are the strains that are included in the vaccine. So we have 4 subtypes, and this is based on the main strains that would have circulated last year. So we have A Victoria 2019, H1N1 swine flu. We have A Cambodia, H3N2, which is the bird flu, and 2 of the type B. Next slide. So this is our target population that we're looking at, and this is what we call our high-risk groups. So children aged 6 months to 5 years of age, adults over the age of 65, and we can look at above 60 as we did for COVID-19, persons suffering from non-communicable diseases, diabetes, hypertension, asthma, and the like. Pregnant women, again, have a slightly higher risk in terms of complication if they do get the flu. Persons with compromised immune systems, HIV and lupus. Persons with chronic respiratory illnesses, asthma and COPD. Persons who are overweight or obese. Healthcare workers because of their exposure risk, and members of national security, customs, and immigration, again, because of their high exposure rate. Next slide. So benefits of the flu vaccine, again, keeping you from getting sick with the flu. It does not prevent all infections, but it will decrease the severity and the risk of hospitalization and possibly death in persons who would have taken the vaccine. Again, protecting women during and after pregnancy as well. Next slide. So where will they be available? So I just confirmed with my manager of the EPI program. Distribution began on Monday and has been going on throughout all counties of the country. The last county should pick up their vaccines today. So from tomorrow morning, all health centers throughout Trinidad and Tobago will have a supply, and you'll be able to access your influenza vaccine at any health center, as well as the Sentinel physicians, which are private physicians who form a part of our Sentinel physician program. Those will be available from early next week, hopefully by Monday. And we're asking the Sentinel physicians to reach out to your CMOH offices, as per usual, so that you can pick up your supply of vaccines as well. Health center times throughout Trinidad, as you know, are usually 8 to 4. Monday to Friday for most health centers across the island. So last slide. In conclusion, COVID-19 and influenza viruses are similar in transmission, symptoms, and treatment. Therefore, as we enter the flu season, it is obviously difficult to differentiate the two, even for a trained clinical person. So we present if we have deterioration of symptoms. We will possibly be swabbed to see if it is COVID-19 to rule it out as well. We can also test for influenza strains at the Trinidad and Tobago Public Health Lab and the Caribbean Public Health Agency. Continued social distancing, wearing the face mask, and of course, if you develop any of the symptoms and you're concerned, contact your nearest healthcare facility as soon as possible. Thank you, Mr. Alexander.
Thank you very much, CMO. I now hand you over to Dr. Extavor, who will speak on shelf life considerations for COVID-19 vaccines. Dr. Extavor, good morning.
Good morning. Thank you, Al, Dr. Parasram, Dr. Wheeler, Dr. Pombo, members of the viewing and listening public, and members of the media. Good morning. And we can go to my slides immediately. Thank you for inviting CARPHA today. Can I have the first slide? Thank you. So I wanted to go through some key questions or give you an understanding that the main question regulators and manufacturers ask is really, when we produce this vaccine, will it stay as we need it to? Will it remain good over time under different environmental conditions? Meaning, will the chemical makeup remain the same? Will the physical characteristics remain the same? Will it still be potent when exposed to normal use conditions, when it's frozen, when it's cold, or if it's exposed to extreme temperatures, or even when it's shaken or in use? So those results need to be consistent, and manufacturers do tests, called stability tests, through using different types of batches of those vaccines. Next slide. So some vaccines and other pharmaceutical products differ in terms of their shelf life and stability because there are differences in the chemical and physical properties in how they're made, in the procedures used to manufacture them, the active ingredients used, the containers they're kept in, how those containers are closed, as well as the formulations. So all those are very key considerations. They also take into consideration what kind of climate those vaccines will be going into and what can happen. So for instance, in our conditions, we are considered hot and humid climates, and it's the most extreme according to the global standards, which is zone 4B. But they also consider what if that vaccine or that product is exposed to higher temperatures than it's supposed to be. So they do all those tests. They have the long-term tests for normal room temperature conditions. They would have accelerated tests under which they would give it under extreme conditions, higher temperatures, higher humidities. They will test those batches under stress, or they will have simulations of it being used, even if it's someone having to withdraw from the vaccine. Because when you have to periodically use something, you need to know that if it has to go back in a refrigerator, how long can you rely on it to remain potent? Next slide, please. So we know for the COVID-19 vaccines, there are different vectors, there are different ways in which the technology was used to make these vaccines. So you will see differences in their shelf lives. Next slide, please. But when initially the emergency use authorizations are considered, the manufacturer will have to present initial data on batches they tested for a given period of time. And that would be evaluated, and the regulator would say, okay, this shows that it will remain stable for an initial period. However, those tests will still be ongoing. In fact, there are batches that will continue to be tested and under those conditions for at least 2 years. So as that information emerges, the evaluator or the regulator receives that, and they determine what the adjustment, if any, to be approved. And that's why sometimes you will get a new expiry date, because now you have more data over a longer period of time that says, yes, it would retain its potency, its chemical structure, and its physical composition. Next slide, please. So overall, this is just a quick look at the ones we currently have in use in Trinidad and Tobago. And I've highlighted to the right with Pfizer-BioNTech, which is now listed at 9 months expiry, which changed. That's not the only aspect that changed. The refrigeration conditions actually also changed earlier this year. and the Johnson & Johnson vaccine storage conditions also changed from 3 months to 4.5 months. So just wanted to give you a quick overview of that. Next slide, and that's it. Thank you very much.
Thank you very much, Dr. Extavor. I am pleased to welcome Dr. Wheeler back to the MOH virtual updates. Dr. Wheeler will present on the extended shelf life for unused Pfizer COVID-19 vaccines. Dr. Wheeler.
Good morning, and thank you, Mr. Alexander. CMO, Dr. Parasram. Good morning. Good morning, Dr. Extavor and Dr. Pombo, my colleague online from PAHO, WHO. I just want to start by letting you know that I would give an introductory explanation, and I will ask Dr. Pombo to focus on the details of the extended shelf life for the unopened vaccines and to give a bit more information on the various considerations given the temperatures at which the vaccine is stored and the shelf life when they're stored at these different temperatures. So as you would have heard, of course, from the news, and you just heard the explanation from CARPHA about the extension of the shelf life of the vaccine. Now, this is not something unusual for vaccines to have their shelf life extended. WHO issued a letter which states the recommendation to extend the shelf life of unopened Pfizer vaccine vials from 6 to 9 months at temperatures from minus 90 degrees to minus 60 degrees centigrade. In addition, the unopened vaccine vials may be stored and transported at minus 25 degrees to minus 15 degrees for a single period of up to 2 weeks. So here we're talking again about the unopened vaccines. But while the vaccines, once they're thawed, the vials can be stored, while thawed, the vaccine vials can be stored at 2 to 8 degrees centigrade for up to 1 month or 31 days within the 9-month shelf life. Now, again, I want to pause and say it has nothing to do with any safety risk when we extend the shelf life of a vaccine. This is quite common, and Dr. Pombo will mention that there are other vaccines that have been treated this way, and in fact, over time, as clinical information and the use of vaccines ongoing, that vaccine shelf life can be extended up to 3 years. So the decision on the extension of the shelf life of the vaccines from a Pfizer vaccine from 6 to 9 months, the unopened vaccines, this is based on a review of the data by the WHO and the European Medicines Agency and by the Office of Vaccines Research and Review of the Center for Biologics Evaluation and Research, as well as the U.S. Food and Drug Administration. So this is quite a robust recommendation. This 3-month extension applies to vials manufactured after EMA approval, and that date was the 10th of September 2021. But in addition, this extension may be applied retroactively, and this is important for us, to vaccine vials manufactured prior to this approval. We know, of course, that Trinidad and Tobago received a generous donation of vaccines from the USA, and therefore this extension of the shelf life of these unopened vaccines also extends to this donation. The EUL Emergency Use License holder has submitted a Dear Healthcare Professional communication updating the cartons with an expiry date of June 2021 through March 2022, as long as approved storage conditions between minus 90 to minus 60 degrees centigrade have been maintained. And I think it is important to emphasize the fact that the vaccines that have been received by the country from the USA, they do conform, and this does apply to them, these unopened vials of the Pfizer vaccines. And again, I want to reiterate that this has nothing to do with the fact that they may be more safe or anything like that. It is part of the ongoing review of the data on the use of vaccines, and it is completely normal. I just want to say as well that before the Pfizer vaccines were administered, I know that the Ministry of Health and all the persons responsible for administering the vaccines were trained in the use of the Pfizer vaccines, because these vaccines had hitherto been unused in Trinidad and Tobago. So the administration of the vaccine remains the same. We know that for the storage that was previously mentioned, some of the critical things are that they continue to monitor and record the temperatures of the freezers in which the vaccines are kept. This is very critical for key steps for storage and distribution of the vaccine. And when the vaccine is actually moved to 2 to 8 degrees centigrade, there needs to be labeling of the secondary packaging and a record of the new expiry date. And therefore, the government has to be prepared to take these steps in order to ensure that there is adequate labeling, accurate labeling of the new date of expiry of the vaccines. I would now like to pass over to Dr. Pombo to say some more on a technical level about the different temperatures of the vaccine in accordance with the shelf life, relating it back to the shelf life and the use of these unopened vaccines where the shelf life has been extended from 6 to 9 months. Dr. Pombo, over to you.
Thank you very much, and good morning to everybody, and thanks for the invitation to attend this press conference today. Just in addition to what Rian from the Caribbean Regulatory System and our country office representative had mentioned about the stability of the vaccines and the establishment of the shelf life, I would like to just remind everybody that the vaccine shelf life is defined according to stability studies that are conducted by each individual manufacturer for specific vaccines, specific presentations, in the natural conditions and temperatures at which those vaccines must be stored. It means that in the case of the Pfizer vaccine, those natural conditions are -90 to -60 degrees Celsius, is what is considered natural from the manufacturer point of view when the product was developed. It means that as part of the emergency authorization approval or as part of any temporary approval to respond to the pandemic situation, manufacturers need to collect data that respond to those natural conditions on a rolling basis submission procedure, and as much information as is recorded and produced, this information is sent on a certain period of times that were agreed with the respective national regulatory authorities for them to review the data and to support changes that occur during the post-approval conditions of those vaccines. In this case, if you go back and look into the news, you will notice that although the vaccine from Pfizer was approved at the end of last year or the beginning of this year, depending on the different national regulatory authorities' decisions, or even the WHO emergency use listing procedure, in May, Pfizer submitted data to the FDA, the Food and Drug Administration in the United States of America, as well as to other regulatory authorities in the world, to support the storage of the undiluted vaccine for up to 1 month at conditions of 2 to 8 degrees Celsius, means in the refrigerator instead of an ultra low temperature. Subsequently, in August and September, this same manufacturer submitted data to the US Food and Drug Administration and the European Medicine Agency and other regulatory bodies at global level to support the extension of the shelf life from 6 months up to 9 months when the vaccine is stored in what they consider natural conditions, which is minus 90 degrees to minus 60 degrees. This decision was also applicable to batches that has been expired prior to the time where the regulatory authorities approve the extension, means prior to August or prior to September, depending on where this vaccine, the extension was approved. And this is what is recommended to all the member states that are currently having stocks available of those batches that originally reflected either June, July, or August as expiry date in their labels. And the decision is made based on the evidence of the stability data that is generated by the manufacturers and as part of the rolling submission procedure that they agree with the respective authorities to grant and to oversight the quality of this product. As Brian mentioned in the previous presentation, the stability data that is generated by each manufacturer assess all quality attributes of the product, means the physicochemical characteristics, the appearance characteristics, the potency of the vaccine, and although in some cases this new shelf life will not be reflected in the labeling, what our country representative just mentioned in the intervention is very key for all the health practitioners and the immunization program at country level to keep records on the new shelf life for those vaccines, so there are no concerns from the quality, safety, or efficacy of this particular vaccine. During the emergency, all the regulatory authorities have granted temporary authorization for vaccines and other medical products that were required as part of the COVID-19 response, which are based on science and which are based on the evidence of information that is generated by each manufacturer as part of the submission of the information to the regulators. One thing that is very important is that these changes in the original conditions that are approved for vaccines are often needed and are often happening. And I will recall the example of the oral polio attenuated vaccines that has been used for many, many years in the region of the Americas, and we can say that we are free of polio in this region due to the vaccination practices. And this vaccine originally, when it was approved by the regulatory bodies and by WHO pre-qualification team, was only granted for a shelf life of 1 year or 6 months, depending on the conditions where the vaccine was kept in refrigeration or under freezing conditions at minus 20 degrees. Today, we have oral polio vaccines that are able to be stored at 2 to 8 degrees under refrigeration, or the same vaccine that is kept under conditions of minus 20 degrees for up to 2 years. So as you can see, this is not happening only for COVID-19 vaccine, it's also happening for other vaccines that are currently used in immunization programs. And what is important is that all the decisions are based on the information and the scientific evidence that the quality attributes of this particular vaccine are not affected due to the changes or due to the extension. In this case, conditions. Yes.
We'd like to thank you very much for the contribution, as well as Dr. Wheeler. Thank you very much. At this time, we move to our question and answer segment. We remind our media representatives to state your name and the name of the media house that you represent before asking no more than 2 brief questions. Please identify the panelists to whom you wish to address each question. And of course, time permitting, we will accommodate a second round of questions from our media representatives. At this time, we'll take our first question from azpnews.com.
Good morning, Priya Bihari, azpnews.com. My first question is for the CMO, and the second question is for either Dr. Wheeler or Dr. Maria Pombo Castro. Good morning, CMO. We have a report that a 34-year-old man who was COVID-19 positive, he passed away, and the relatives are concerned that when he went to hospital, he was treated more for COVID-19 and not for the other issues he had. So my question is, therefore, when someone goes to hospital, are they treated only for COVID-19, or are they treated for any of the issues they would have? And my second question is for the PAHO representatives. There are reports of a mutation of the Delta variant, I think it's AY42, and my concern is that, is it, the vaccinations now, are they going to be effective against these new mutations, and is PAHO going to focus certain brands of vaccines for certain variants? Thank you.
Okay, thank you, Priya, for the question. When a patient goes into hospital, they're treated for all their symptoms, all their signs, all their diseases. They're not treated for one particular disease only. Of course, one is what they would present for. For example, you're presenting for COVID-19, you're in respiratory distress, you have shortness of breath. So that is your presenting complaint. They will treat that condition to make sure, or the most severe or critical condition that requires treatment first. If you have other symptoms and signs suggestive of other illnesses, that will also be treated at the same time. So the clinicians will treat an entire patient. They do tests, as you know, when you go in to determine if there's other things or underlying causes, and they treat as they see fit based on what they find. I hope that answers the question.
Thank you very much. Dr. Wheeler?
Thank you. Thank you very much for that question. Thank you very much for that question. First of all, I would like to say that when there are assessments made of the different variants, there are 2 things. There are variants of concern and there are variants of interest. We always expect viruses to mutate. That is just the nature of viruses. As Dr. Parasram recently mentioned with the flu vaccine, every year you get your flu vaccine. It's not exactly the same flu vaccine. The composition varies a little bit because the virus changes. This is no different with the COVID-19 virus. And yes, we have seen different variants at this point in time, and new mutations have not been listed as variants of concern. We have the variants of interest that WHO and PAHO were looking at to ensure that, of course, that they don't become, when they become more transmissible, they then become, or if they become more virulent, they become listed as variants of concern. This is not the case. And in terms of certain vaccines recommended for certain variants, no, not at this point in time. We have seen that the current vaccines remain effective against all of the variants, both of interest as well as of concern. So at this point in time, there is no scientific basis for recommending any one vaccine over another for any variant, whether they be a variant of concern or a variant of interest. I can invite Dr. Pombo if she would like to add anything to that, but that's the current situation as we know it. Dr. Pombo?
Nothing else to add from my side, Dr. Wheeler.
Thank you.
Thank you very much. We go to 103.1 FM. Good morning.
Hi, good morning to everyone. My first question, both actually have to do with the influenza season. First of all, Dr. Parasram, you would have mentioned that there would have been help from the COVID-19 measures in decreasing the influenza rates. How did the figures look last year as compared to the year before that, 2019? And the other question is, what's in place for any potential influx of persons coming for testing, not knowing if they have COVID-19 or influenza? Has anything been learned from the past influenza season that could help do things differently, if at all? Thank you very much.
Okay, so I have the figures from last year and this year on me. So in terms of influenza suspected cases for last year, up to Epi week 40, which is the same sort of time, maybe about a week ago, we had 830 cases, no confirmed deaths during that period. And for this year, similar period, we have 115 cases so far. I can get figures going backwards if you like, and we can share that with you afterwards, but that is what I have on me. In terms of lessons learned, we generally do anywhere between, and I just came from a visit to the Trinidad Public Health Lab, we do about 600 to 800 COVID-19 swabs per year. The same sample that we take for COVID-19, which is a nasopharyngeal swab, we also take to identify influenza. Severe acute respiratory illnesses, we take that sample and we test for both things. So we can also tell with that sampling technique if you have influenza or you have COVID. And we have some surplus testing inside. So generally, in terms of testing capacity, the country can do anywhere between 11 and 1,200 cases per day. In terms of testing, we're doing about 600 to 800 at this point in time. So we have some reserve capacity by way of testing. If we do see a surge in terms of people presenting with respiratory symptoms, we have some capacity inside. And in terms of our hospital, we have the medication. As you know, Tamiflu is one of the drugs, antivirals that we use for influenza. We have sufficient stock with good expiries of that particular medication as well. So with the public health measures that are in place, we see a considerable reduction in influenza over the last couple of years as well. So it is good. It's a good knock-on effect of the public health measures that we put in place for COVID.
Thank you, CMO. We go now to Newsday. Newsday, we are ready for your questions. Good morning.
Good morning, everyone. Rihanna McKenzie from Newsday. I hope you can hear me clearly.
Go ahead.
All right. So I did have some technical issues on my end, so I apologize if you answered this already, CMO. But in relation to the COVID-19 vaccine, when can you take the influenza vaccine? So if you've recently gotten vaccinated for COVID-19, how soon can you get the influenza vaccine?
Yeah, so yesterday
second question.
Yeah, go ahead. Go ahead with your second question first.
Second question is what about vaccination acceptance for the influenza vaccine on an annual basis? Is there hesitancy where the influenza vaccine is concerned, as it is not a mandatory vaccine?
Right. So in terms of your first question, thank you for that question. Generally speaking, as it relates to your COVID-19 vaccine, so we have a 2-dose regime and you have a 1-dose regime, right? So we are asking that when you have your second dose of a 2-dose regime, you wait at least 2 weeks before you have your influenza vaccine, and vice versa. If you have your influenza vaccine, you give it 2 weeks, and then you can begin your COVID-19 regime. For a single-dose regime, of course, you have 1 dose, and then you can wait 2 weeks and have your influenza. And the converse is the same as well. In terms of, just to give you all some idea of what kind of figures we have been distributing and using over the last couple of years, for the 2018-19 flu season, we would have given out 55,221 vaccines. In the 19-20 season, which was just before COVID started, and then we saw a dip when COVID came into play, we had 118,015 vaccines given to the country. And in the 2020-21 season, we had 75,887 vaccines given out. During that period of time, we have placed an order for 100,000 vaccines, influenza vaccines for this year. We have received the first 50,000 from PAHO, and we're expecting a tranche of 50,000 again. Of course, if we need additional supplies, we will continue to work with PAHO to get additional stocks.
Thank you, CMO. We go to Power 102. Power 102.1 Digital. Good morning. Okay, they may be having some technical difficulties, so we go to IETV.
Hello, good morning.
Okay, Power
Can
102.
you hear me?
Yes, we're hearing you.
Yes, Sparkle. Good morning, Sparkle McIntosh, Power 102 Digital.
Yes.
Both of my questions are for CMO Parasram. Dr. Parasram, given that TNG is recording on average 10 deaths per day, equaling 70 per week, what percentage of patients going into ICU are surviving? And secondly, do we have adequate ventilators to service ICU patients if we get back to capacity ICU occupation? And during our peak COVID hospitalization months ago, were patients who were in need of ventilators all able to be treated with ventilators?
So I think you asked a number of questions.
Yeah, yes.
So I will try to answer the ones that I found. So our average generally is around seven deaths per day over the last couple of weeks. In terms of the persons you're asking, if at our peak, if the ventilators were sufficient, I think at the end of the day, we reached about 75%, if I recall, of our hospital occupancy at the height of our epidemic a couple of months ago. Meaning, of course, that we still had some capacity, spare capacity. So we hadn't reached our maximum capacity at that time. So we were able to afford those people who were in hospital the care that was required at that point in time. In terms of the question, I think this has been asked a number of times in terms of ICU admission. So once you go into an ICU, is at an intensive care unit. You require significant amount of clinical care. In most instances, you can't support your respiratory system on your own. You require inotropes to support your cardiac system. So you're in a critically ill state. Outside of COVID, the survival rate is generally variable aside from when you have elective medical surgical procedures. So I don't have a percentage on me right now. Generally, however, a number of persons who have gone into the ICU system have been able to survive and come out and are now fully recovered from COVID-19. And we give the best care that is possible, especially in light of the WHO approval for the IL-6 receptors. We are able to use that in that particular group of people as well. Gives us additional armory in that regard. But I think the key to it is, of course, making sure that you are vaccinated as soon as you can, because the data would show that the hospitalized patients, as I read this morning, continue to be largely the unvaccinated group of people. 94.5% of people in hospital during the period July 22nd to September 29th were indeed unvaccinated, and we really want to get that number of unvaccinated people in the country much smaller, so we have, of course, less people being hospitalized and less deaths from that group.
Thank you very much, CMO. And we now go to 103.1 FM, but I want to remind our media representative to stick to the two questions, please. Thank you very much. 103.1 FM. Sorry, IETV. My apologies, IETV. Please unmute. Okay, so.
Okay, great.
Right.
Hello?
Yes, we're hearing you.
Right, Bina here from ITV News. I have one question to CMO. CMO, recently we would have noticed a number of persons on social media complaining of side effects from the vaccines, particularly women who have noticed a significant change in their menstrual cycle. I know about 2 weeks ago, Dr. Sergio Singh would have said that the ministry did not receive any official reports on it, but given the recent surge in complaints, do you all have any updated review based on these reports? Thank you.
So I mean, locally, Dr. Sergio Singh would have spent a lot of time actually responding to this question before. I don't want to go over what he has said, but Dr. Wheeler said she can add from a PAHO perspective what she has seen.
Thank you, CMO. as in all of these situations, when you take a public health perspective, the number of cases in a population need to reach to a certain level before we can declare that it is something that is of a public health concern. At this point in time, we have heard and we are aware of these reports, but it has not been stated by WHO or PAHO that this is of a public health concern. And of course, such women should discuss these issues with their gynecologists and treat accordingly. But we don't have any official position on this at this point in time. Thank you.
Thank you very much, Dr. Wheeler. Now, from time to time, we get some questions from the media. From time to time, we do get questions from media personnel, and at this time, we would want to field some of those questions. Firstly, the Ministers of National Security and Health recently, approximately 2 months ago, visited the maximum security prison and were interviewed on Rise Maximum Radio to promote the vaccination drive. How successful has that been, and how many prisoners and or officers have since taken the vaccine?
So yes, I know the Honourable Minister would have visited together with his colleague Minister of National Security. They also had with them the Principal Medical Officer of institutions, Dr. Richards, and Dr. Hazel Otello, who is the Mental Health Director. So they would have been on the prison radio station in the Golden Grove site a couple of months ago to promote vaccination to that particular cohort, both the prisoners and the officers. We made available to the Ministry of National Security vaccinations to cater for that cohort, but I think the number of persons vaccinated in that group will better be handled by the Ministry of National Security.
Thank you very much. Our second question comes in. Are there vaccine mandates for admittance or visitation to state-run or state-funded drug treatment facilities? This is asked because senior homes now require visitors to be vaccinated. And the few that have been called, at least, they're not sure if that's an MOH or self-imposed regulation.
Yeah, so the Ministry of Health has not given any such mandate to the drug treatment facilities. There is, however, one such facility which receives funding by way of subvention from the ministry. The others are self-funded, but we have imposed no such regulation from the ministry side.
Okay. For the question, has the ministry said definitively how many fully vaccinated persons that would have died from COVID? They said 2% on Saturday, but they had not given an exact number.
Okay, sure. So in terms of what was said on Saturday, 2% is correct. So to give a number to the 2%, 1,354 persons, which account for 98% of the persons who died, were not fully vaccinated. So accounting for that 2%, we have 28 persons who would have been fully vaccinated at the time of death.
Okay. Follow-up question. This question is on behalf of persons who followed the advice in foreign countries and took a mix that WHO did not approve. What do people with the wrong combination of mixed vaccines do? Do they have to revaccinate? And if so, is that safe? Are they treated as unvaccinated? Also, persons who took vaccinations in Canada and Guyana would like to know what they must do to be allowed in a safe zone. Do they need to revaccinate, and is that
sure? So I'm glad that PAHO is here with me. So we have stood on the back of WHO and PAHO in terms of our reliance for vaccination. The government's policy is based on reliance for WHO and has been so for many, many years. So all our vaccine, what we consider to be fully vaccinated, is based on receiving a WHO approved combination or vaccine type. So as WHO continues to expand their list, and I saw, for example, listed on the WHO website that Covaxin, which is a vaccine out of India, is due to get possible approval by the end of the month. So as vaccines are added to the WHO list, they will also be added to the Trinidad and Tobago list of accepted vaccines. And we really look forward to more vaccines being added to that list in the near future, so more persons can join these spaces as well.
Okay. There have been reports that people who get to the hospital for a condition are being asked to take a COVID-19 test. But they are told that if they test positive, they will have to go home and be quarantined. They will be allowed to stay in the hospital for treatment only if they test negative. Is this the case? And if the person dies or gets critical, how is the death classified? Does it mean doctors are neglecting their duty?
Okay, so basically I think it is a question we had answered a little earlier on in the program. So generally speaking, someone goes to a hospital facility. At this point in time, as I said, we are doing 600 to 800 tests a day. So anyone that requires hospital care, generally speaking, in the A&Es, they do a COVID-19 swab just to ensure that you're not positive. In the event that you do have to be warded, you're not put onto the ward being a COVID positive patient. If you are COVID positive and you require hospitalization, you are then taken to a parallel healthcare facility institution, which, as I said, you are treating for COVID as well as any other complaint that you may have at that point in time. If you are COVID negative, of course, you'll be treated as per normal in the existing system. And if you are positive and you don't require hospitalization, which is the case in some instances, if you have mild symptoms, for example, you go with flu-like illnesses, you can be asked to go home. And of course, if symptoms worsen, you will be contacted by the CMOH, or you can contact the Accident and Emergency Department or GMRTT so that you can be brought back into hospital as the need be. But as far as I'm aware, the clinicians follow the guidelines and they make the final decision in terms of the attending physicians at those sites.
All right, this final question coming in from members of MAT and has to do with deaths attributed to COVID-19. How many people have died, like Colonel Powell, from complications related to COVID? That is, COVID exacerbated their pre-existing conditions, example heart, that led to their death.
Okay, sure. So yesterday, the Honorable Minister and myself, together with our corporate communication, would have met with the incoming president of MAT, and there was agreement to add some additional data to the deaths. So, for example, we have five deaths listed on our website. From comorbidities, we wanted to go a little more granular in the data. So we'll put, for example, 4 of those would have had diabetes, 4 of those would have had hypertension. So we're looking to add that data in the coming days to the website, or even to the COVID-19 brief update, so that we can explain a little bit further what is happening, of course within the confines of patient confidentiality, so we don't breach that part of it as we present our data.
Thank you very much. We go back to our media representatives. TV6, we are ready for your questions.
Hi, good morning. Is it that Matt gets preference for questions and they get to pose questions to you guys? Because we've been waiting here for a little while. Good morning.
Certainly not, Overshi. These questions would have come in from Matt, and we are facilitating. Of course, these are members of Matt like yourself. And so these questions would have come in from them. Thank you very much. We're ready for your question.
I am present in the meeting. Thank you.
Of course, I'm present. We're ready to facilitate your question. Thank you.
Thank you, Dr. Parasram. As far as my recollection goes, we never got information on excess deaths. Could we get that, please? And as it relates to the deaths, you did mention that it's an average of 7 for the week, a daily average of 7. But what commonalities do these COVID deaths have aside from vaccination status, aside from most of them are not vaccinated? Could you please tell us some of those commonalities? We noticed that a lot of them are elderly persons. Is it that elderly persons are not sufficiently vaccinated? Thank you. And my second question is to Dr. Maria Pombo Castro. Dr. Castro, when can we, well, of course, the pandemic is being described as a pandemic of the unvaccinated. A lot of the unvaccinated, not just in Trinidad and Tobago, but across the world, will, of course, be children. Could you give us an idea of the status or stage of the approval of vaccines such as Pfizer, Sinopharm, and I just heard the CMO mention Covaxin. What is the status of that? How soon can we see approval for the children age group? We noticed that Pfizer seems to be closer to the finish line, whereas Sinopharm is a tried and tested platform. Thank you.
Yeah, so in terms of your question, excess mortality, I would ask Dr. Hines to get that data for us. He has been liaising with the Central Statistical Office to try to compile all the data from the entire period, and then he can possibly present that to you all in the near future. Related to the types of people we're seeing in the death profile, generally speaking, as you said, elderly persons, generally speaking, with diabetes, hypertension, you're seeing people with cancers, end-stage renal disease. That is the sort of profile we have been seeing over the last couple of weeks or months, I would say. Again, unvaccinated individuals within that particular cohort tends to be the majority of it. Of course, there's outliers to every rule, but generally that is the type of patient you have been seeing in terms of your deaths.
Thank you very much, CMO. We now go to CL Communications.
Sorry,
my apologies.
Providing the answer to the question before. So regarding the question on when approvals are expected for vaccines, the different vaccines available in pediatric populations, so the advances for each manufacturer are not available publicly. So the only ones we know that are in the process of providing all the information requested by respective regulatory authority is Pfizer. So it's not approved yet for populations below 12 years old. So this is what I can provide today. So unfortunately, we don't have those levels of details today.
Thank you very much, Dr. Pombo. We now go to CL Communications.
Hi, good morning. Natalie Singh, Caribbean Lifestyle Communications.
Good morning.
I just wanted to find out, there's a minor question for Dr. Wheeler. How many times in your experience has the expiration of vaccines has had to be extended? And then my second question for CMO, can you give an update on your meeting with the police as it pertains to the safe zones policy and establishments? I think you had mentioned in our last meeting that you were going to meet with them. And then thirdly, just a point.
We'll take the two questions. All right, thank you very much. Dr. Wheeler?
Thank you for the question, but that is better answered by Dr. Pombo because I did not work in the area of vaccines and biologicals. But I know from my discussions with Dr. Pombo, this has happened several times over the years, so she can give those details. Over.
Thank you very much. Dr. Pombo?
Sorry for the inconveniences. Yes, in fact, it has happened in the past with several vaccines, either because there are changes in the formula to improve the stability of the vaccines, and that's the example for pentavalent vaccines, for, as I mentioned, polio vaccines, and also for many others that started at the beginning of the authorization with a 2 years shelf life based on natural data, and has been extended up to 36 months in many cases. So it depends on the product characteristics, it depends on the stability of the product and the conditions that the manufacturers define. So far, this is what we have seen. We are expecting that next year, all or most of the COVID-19 vaccines available right now will be changing formulas in order to have a more stable solutions or even freeze-dry vaccines that can be stored longer and can help countries to handle a better stock.
Thank you very much, Dr. Pombo. CMO.
Yeah. So yes, we did have that meeting after the press conference last day, I think Monday. So present were the members. So we did have the meeting with the police service. So it's not the police service alone. We had the Chief Public Health Inspector from the Ministry of Health. We had all the CMOHs, including Tobago, present. We had the city corporations, as well as the Trinidad and Tobago Police Service, who are all parts of the enforcement and monitoring arm as it relates to public health measures. So the meeting was very cordial. I think everybody was in agreement with where we stood. We were trying to iron out little teething issues that it relates to enforcement. For example, getting copies of the immunization cards from different jurisdictions so that the police could have that with them as a sample. Working together as a team, so doing joint inspections rather than, for example, having a public health inspector go on their own. So that has been happening in some of the counties where the police has teamed up with the Ministry of Health's Public Health Inspectorate to go out and do joint inspections. So the meeting went very well, and we will try to do almost a weekly meeting from here on in, at least for the first couple of weeks, so we can get the teething issues out, and then we can go from there. But the collaboration has been strong and even strengthened in light of COVID-19, because we do have a COVID-19 focal point from the police on my interministerial task force. So I think the communication is very good, and the relationship that we have is very strong.
Thank you very much, CMO. And finally, we go to Guardian Media Limited.
Hi, really quickly. I know you're supposed to have a meeting, so you need to up screen. I wanted to get an update on the use of booster shots locally. Have we made a decision on that, and when, and if not, when can we expect that? So
just to clear up the discrepancy, and I'm glad PAHO is here as well. The SAGE group, which is an advisory committee that advises PAHO, would have had a meeting last week, I think, advising of Sinopharm, for example, using a third shot. So it is not called a booster. It is an actual third primary shot. So to enhance the immunization coverage in special groups who otherwise would have a slightly decreased immune response. So the group identified for Sinopharm, for example, are those persons over 60. I would have met with my TAG group again yesterday, which is the National Advisory Group, Technical Advisory Group for Vaccination and Immunization. And we came to consensus that technically we were okay with the recommendation. As you can be aware, we have to look at a lot of things before we change a policy in terms of access to vaccines, supply of the vaccines, if we have enough vaccines to actually deal with our cases. And there was a statement in the document that, of course, said that you should ensure that you have sufficient vaccination of 2 doses to your general population before you consider going into a 3rd dose for any given subpopulation. So we're taking all of those things into consideration, and we will communicate with the public as soon as we decide to launch that initiative. Of course, the Honourable Minister would be given a technical brief as well as it relates to our deliberations in the TAG. I don't know if PAHO wants to add anything to it.
Thank you, CMO. I just want to emphasize that the position of WHO and PAHO is that for healthy people who have received 2 doses of WHO-approved vaccine do not need, at this point in time, there is no scientific or clinical evidence that they need a booster shot. But as the CMO was just saying, there are people who are immune compromised, who probably their immune response is not very strong, who would need a booster shot. But also the latest clinical data, I was just discussing it this morning, there are some people whose levels of immunity are so weak that they don't show a response. But these are exceptions to the rule rather than the average healthy person. On the basis of equity, which is really extremely important for WHO and PAHO, again, as the CMO said, the rule is to have as many people as possible vaccinated. And we know in some parts of the world, like low-income countries, the percentage of people who are vaccinated still remains far too low to protect the majority of people on the population. So our emphasis should really be on getting as many people as possible vaccinated so that even those who may not have a strong immune system, who are immune compromised, can also be protected. So we should really be looking at issues of equity for the coverage of a population first. But I agree that there are special persons within a population who may not respond very well, or whose response after 2 doses of an approved vaccine is still not of a sufficient nature to protect them. Those are the people we should be thinking of for booster shots. But we must keep the bigger picture in mind and make sure that as many people in the population are protected so that they can be protected themselves, their families, and their loved ones. Thank you.
Thank you very much, Dr. Wheeler, and the rest of our panelists. That's all the time that we have for the question and answer segment. And in closing, we ask that you please continue to protect yourself and your loved ones. Remember, the COVID-19 vaccines are approved by the World Health Organization. They have proven time and time again to be safe, effective, free, and available, and of course, accessible at many points. These vaccines are available in all 5 regional health authorities, at all 109 public health centers, in addition to the advertised mass vaccination sites. If you haven't received your COVID-19 vaccine as yet, please get yours now. Don't delay. Vaccinate today. Be safe and goodbye for now.